Rickets is an musculoskeletal disease. Look at this picture, shows that normal bones and rickets, bone softening. Look at this bending. X-rays, bone deformities, and CT findings. Look at this. A detail going on. Introduction. Rickets is a pediatric skeletal disorder characterized by the weakening and softening of bones due to defective bone mineralization. It is primarily caused by prolonged vitamin D deficiency, which disturbs calcium and phosphate metabolism, essential for healthy bone formation. Though preventable, rickets continues to affect children in various parts of the world, particularly in regions with nutritional deficiencies. A definition. Rickets is a condition seen in growing children leading to bone deformities due to impaired mineralization of the growth plates and bones. It results from inadequate vitamin D, calcium, or phosphate levels necessary for normal bone development. Types. 1. Nutritional rickets caused by insufficient intake of vitamin D, calcium, and phosphate. 2. Vitamin D dependent rickets, VDDR, a genetic form where the body cannot adequately process or utilize vitamin D. 3. Vitamin D resistant rickets, X-linked hypophosphatemia, genetic rickets where the kidneys cannot retain phosphate effectively. 4. Hypophosphatemic rickets caused by low phosphate levels due to kidney related disorders. 5. Drug induced rickets associated with long-term use of medications that affect vitamin D metabolism, example anticonvulsants. Causes. 1. Nutritional deficiency, lack of vitamin D in diet or insufficient sun exposure. 2. Malabsorption disorders, conditions like celiac disease or cystic fibrosis that impair nutrient absorption. 3. Chronic kidney disease, impaired phosphate handling and vitamin D metabolism. For genetic disorders, mutations affecting vitamin D synthesis or phosphate metabolism. 5. Medications, use of anticonvulsants, glucocorticoids or antiretrovirals. Risk factors. 1. Infancy and early childhood, periods of rapid growth with higher nutrient requirements. 2. Breastfeeding without supplementation. Breast milk contain low vitamin D levels. 3. Limited sun exposure. Use of sunscreen. Living in high latitude regions or cultural clothing practices. 4. Dark skin. Reduced ability to synthesis vitamin D from sunlight. 5. Malnutrition and poverty. Limited access to a balanced diet. 6. Medical conditions. Malabsorption syndromes, chronic liver or kidney disease. Complications. 1. Delayed motor development. 2. Bone fracture due to fragility. 3. Pregnant skeletal deformities, example bowed legs, hyposcoliosis. 4. Dental issues like delayed tooth eruption and enamel defects. 5. Growth retardation. 6. Hypocalcemic seizures in severe cases. Pathophysiology. Vitamin D facilitates calcium and phosphate absorption in the intestines and their reabsorption in kidneys. Deficiency leads to reduced serum calcium and phosphate levels. Secondary hyperparathyroidism, which mobilize calcium from bones. Impaired bone mineralization resulting in soft bones and voidant growth plates. Deformities due to inability to withstand mechanical stress. Step-by-step pathophysiology of rickets. 1. Vitamin D deficiency or dysfunction. 2. Impaired calcium and phosphate absorption. 3. Hypocalcemia. 4. Hyperparathyroidism secondary. 5. A defective bone mineralization. 6. Voidant and weakened growth plates. 7. Skeletal and muscular complications. 8. Systemic effects. Chronic hypocalcemia may lead to tetany, seizures or laryngospasm in severe cases. Growth retardation occurs due to inadequate bone development. This step-by-step process highlights how vitamin D deficiency disturbs the delicate balance of calcium and phosphate metabolism, leading to the clinical manifestation of rickets. Signs and symptoms: 1. Bone pain and tenderness, especially in the leg, arm, pelvis, and spine. 2. Skeletal deformities: bowed legs, thickened wrist and ankle, and pigeon chest. 3. Delayed growth and short structure. 4. Dental abnormalities. 5. Muscle weakness. 6. Increased susceptibility to fractures. Diagnosis: 1. Clinical examination, identification of skeletal deformities and growth abnormalities. 2. Biochemical tests: low serum calcium, phosphate, and vitamin D levels. Elevated angle phosphate and parathyroid hormone. 3. Radiographic findings: widened, cupped, and fade metaphysis, osteopenia, and skeletal deformities. 4. Genetic test for hereditary form of rickets. Nursing diagnosis: 1. Imbalanced nutrition less than body requirements. 2. Impaired physical mobility related to bone pain and deformities. 3. Risk for injury due to fragile bones. 4. Delayed growth and development related to nutrient deficiencies. 5. Deficient knowledge regarding dietary and lifestyle modification. Management: medical management: 1. Vitamin D and calcium supplementation. 2. Phosphate supplements in hypophosphatic rickets. 3. Address underlying conditions, example kidney disease. 4. Surgical intervention for severe deformities. In nursing management: 1. Educate caregivers about diet rich in vitamin D and calcium. 2. Monitor growth and developmental milestones. 3. Ensure adherence to supplementation and follow-up. 4. Support psychosocial well-being of the child and family. Treatment options: 1. Nutritional therapy, adequate intake of vitamin D, example fortified foods, supplements, and calcium. 2. Medications: calcitrol for vitamin D dependent rickets, phosphate binders for renal conditions. 3. Surgery for correcting severe skeletal deformities. 4. Lifestyle changes, ensuring sufficient sun exposure. Psychosocial medicine: 1. Addressing stigma associated with physical deformities. 2. Psychological support for children facing bullying or isolation. 3. Family counseling to manage chronic conditions and ensure adherence to treatment plans. Prevention. 1. Dietary recommendations ensures intake of fortified foods, fish, and dietary products. 2. Vitamin D supplementations, especially in infants, children, and pregnant lactating women. 3. Sunlight exposure promotes safe, regular outdoor activities. 4. Public health measures, nutritional education and supplementation programs. In conclusion, rickets, though preventable, continues to pose a public health challenge in underprivileged areas. Early diagnosis, proper management, and preventive measures are crucial to mitigating its impact. Raising awareness and ensuring access to adequate nutrition and health care can eradicate this condition and promote healthy growth and development in children. Thank you. Have a nice day.